And we're really grateful for your leadership and your work and continued work in the movement. So we have seen a lot of progress in the climate and health movement over the last 6 years. We've notched wins like the establishment of the Office of Climate Change and Health Equity. There's the new National Academy of Medicine Collaborative on Decarbonization of Healthcare, 2 major pieces of historic legislation that really start to steer the barge away from climate catastrophe and towards the climate future. I think that is in all of our vision, a place that's sustainable, that's healthy, and that's just. But there's still so much that we need to do. This year, the consortium will continue its work in mobilizing health professionals to enact climate policy that protects health and promotes equity. We're going to continue growing the movement, so recruiting more and more health professionals into this work on climate, health, and equity. We're going to continue our work on diversifying the movement, understanding that a diverse movement is one that is creative, that is vibrant, and that takes on both the hard things and the right things. We're going to foster collective action by working particularly with our state clinician network that is also notched local and state victory after victory. And we're very, very proud of the state clinician network and seek to continue helping to build that momentum. And then finally, training our advocates in climate, health, and equity for policy, how we frame that for both the public and decision makers to forward the kinds of bold solutions that we need. Our agenda today and tomorrow is really built with this in mind. In a good way, the climate, health, and equity space has become very crowded as people have begun to understand that climate change is a profound health threat. And so this agenda was built after dialogue with our state network and with our steering committee to understand where are our opportunities. You're going to hear a lot about the Inflation Reduction Act. This was a historic piece of legislation, and we cannot miss the opportunity to ensure every one of those dollars is spent towards health and justice. We'll also talk a lot about rulemaking through the Environmental Protection Agency. Where can the health professional voice leverage itself to ensure that we are enacting the strictest standards possible to protect health? And then we'll also hear from 2 top officials in the Biden administration on where they see health professionals plugging in for effect. Mostly though, we really want you all to use this opportunity to connect. We are stronger together, and whether you are in person or you are virtual, we built opportunities for you all to get to know each other, either connect with old colleagues or find your climate community. So we're welcome to have you here today, and I'm just going to talk through a few quick logistics. After this meeting is over, this isn't your last opportunity to engage with us in terms of events. We also heard from our Health Advocate Network that there was a lot of interest in having more communications training. So we're going to have a 5-series course that starts in May. And every 2 weeks, there'll be an opportunity to learn a new skill in communications. It'll be things like how to work with the media, weighing in on policy, writing op-eds, social media, and how to engage with policymakers. If you're interested, scan the QR code, and if you've registered for this meeting, you'll hear from us on this again. I also want to thank our sponsors, without which this meeting would not be possible. So thank you to Johnson & Johnson, the Gordon Betty Moore Foundation, American Lung Association, the Climate and Health Program at University of Colorado, the American Public Health Association, Research America, Trust for Public Land, iSustain, Steve Schroeder, Eco America's Climate for Health Program, Citizens Climate Lobby, American College of Physicians, the Center for Sustainability and Global Environment at University of Wisconsin, National Association of Social Workers, NRDC, Pediatric Associates of Alexandria, Christine Berg, Warren Levy and Holly Rosenkrantz, Yale School of Public Health, and My Green Doctor. Thank you to all of you. You've made this meeting possible. A few other housekeeping issues. Everything you need to know about this meeting is in the program guide. Because we've packed a lot into here, we're going to keep the bios short for our speakers, and you can read their full distinguished histories within the program guide. And then if you're having any trouble with the meeting, please email info@climateconsortium.org, and we will answer your concern or your question promptly. Social media, whether we like it or not, has become a very important way to ensure that our voice reaches outside of our walls. And so please, we encourage social media and this hashtag Climate Health 2023, take pictures of each other, take pictures of slides that you find compelling, and use this tag so we can follow and see what you all took away from this meeting and what we can build on in the future. For those of you who are virtually online, we do have somebody dedicated who's checking the chat box. So please put your questions in there, and we'll make sure to get to some of the virtual questions during the sessions. And finally, just a huge and heartfelt thanks to the staff at the Medical Society Consortium. It was no small feat to put on a hybrid meeting, and the staff has been putting all of its blood, sweat, and tears into making this a successful experience and a fruitful one for all of you. So if you have a chance to see any of these staff members, give them a big thanks. And with that, I'm going to turn it over to Ed.
Good afternoon, everybody, and welcome back to George Mason. For those of you who are coming back, for those of you who this is your first trip, welcome to George Mason University, home of the Center for Climate Change Communication, which is home to the Medical Society Consortium on Climate and Health. And again, I wish to offer my thanks to Mona Sarvati for getting us, for organizing all of us and getting us this far. It's really quite incredible what she has done. So thank you, Mona. And thank you also to the current cohort of Chef Fellows, the Climate Health and Equity Fellows, who were gracious enough to give me 15 minutes of their time yesterday in briefing them. And they showed me in those 15 minutes that my 10-minute talk today was about 10 minutes too long. So I'm going to give an abbreviated version. Apologies to the Chef Fellows who this is your second time through in these comments. Oh, hello. Bingo. I want to share 3 ideas that I consider important ideas with you this afternoon. The first idea is what I've learned in my 40 years as a public communications specialist. This is my niche in the world of publication. I'm a communication scientist. I study what we know about how to share ideas based in science, based in public health science or medical science that are important enough for us to try to share with the public and with policymakers and with anybody else who needs to know. And in 41 years of this work, this is the only thing I've learned with absolute certainty. The campaigns that work, the public health education campaigns that work, they all comport to this model. Simple, clear messages, repeated often, by a variety of trusted and caring voices. And where this comes home to us here today is because our research has shown that we, health professionals, we are those trusted and caring voices with regard to helping Americans understand the personal relevance of global warming. This comes from our spring 2020 survey, Climate Change in the American Mind surveys, we call them. We ask people, how much do you trust each of the following as a source of information about global warming? And what you can see on this slide is if you look on the left-hand side of the slide, that's all voters. As you move across the slide, you're moving towards the conservative end of the political spectrum. And you can see very clearly that people's primary care doctors or their doctors, I don't think necessarily that people differentiate between their primary care and their other doctors, but people have a relationship, a trusted relationship with their caring health providers that create special opportunities for you to share information that most members of the public simply don't know about climate change, showing people how climate change is personally relevant to them. And that special opportunity is especially poignant or especially ripe as you move to the conservative end of the political spectrum. Our friends and families and neighbors who are conservative are much less likely to be on board understanding climate change, anything about it, whether or not it's happening, whether or not it's human caused, and whether or not it's serious. But you have a special opportunity, you and we as through the form of our professional societies, we have a special opportunity to help share what we know with these folks. We have done a lot of messaging research, communication research over the past 5 years, starting with the launch report for the Medical Society Consortium, which we called the Medical Alert Report. I'm not going to go into all of the details. I'll simply say those reports, both the Medical Alert Report and the Medical Promises of Climate Solutions Report, and everything else that we've put out, we've made the effort to understand how people react to this information. And like the polling data suggests, the very people who benefit most from these simple, clear messages that we've developed into these reports are our conservative brothers and sisters and neighbors across the country. They are the ones who most need to open up their minds on the issue of climate change. And you and your trusted voices are really the secret sauce by which we're going to do that. The second point I want to make has to do with something that as health professionals, we've all been incredibly focused on for the past 2 decades. When I got my public health training in the early 1980s, we were very focused on the behavioral determinants of health, how people's individual health behavior was so strongly influential in determining sort of the health trajectory of their lifespan. But in the last 20 years, we've learned that really we need to be focusing not so much on health behaviors, but on the social determinants of health, because it's the social determinants of health, the attributes of the communities in which we live that are so strongly influential on people's individual behaviors. So if we want to encourage and enable people to embrace healthy individual lifestyles, we have an obligation to do everything we can to make sure that we are cultivating the social determinants of health. But what the Medical Society Consortium is really all about is the ecological determinants of health, which my colleague Courtney Howard and about 24 other colleagues and I published a paper this past probably about a week ago now in the Lancet Planetary Health, where we argued that the ecological determinants of health, most importantly, a stable global climate, is even more fundamental than the social determinants of health. Because when we destabilize our climate, we not only have direct harmful impacts on people's health, we also destabilize the social determinants of health. And during climate disasters, we also, a destabilized climate also wreaks incredible havoc with the healthcare delivery system when we need it the most. So this notion of the ecological determinants of health, or in other words, our climate, this really is the most fundamental determinant of health that we all need to keep our eyes on. The third and final point that I wanted to make is that in coming up through public health over the past 40 years, I have been trained to think about tobacco as the leading cause of early death and disease in America and worldwide. And I don't mean to dismiss the seriousness of tobacco use as a threat to public health and well-being. But when you really take a step back and you look at the profound consequences, harmful health consequences of climate change and its root cause, the burning of fossil fuel, you start to realize that perhaps we have failed to appreciate until very recently that climate change and the burning of fossil fuel really is public health enemy #1. So this slide, I simply trying to represent the global burden of premature mortality, early death, as well as the burden of the avoidable burden of morbidity, caused by exposure to air pollution. Just on an apples to apples basis, the global burden of exposure to air pollution versus the global burden of tobacco use, air pollution alone, just early death, taking climate change off the table entirely, and just exposure to air pollution, it is a more potent cause of early death than tobacco use. My conclusion from all of that is our climate and our health have a common, powerful enemy, and that enemy is fossil fuels. As I've come to think through my work more carefully over the past 5 years since we've been together as a consortium, the conclusion that I've reached is the most important thing that we can accomplish together is to revoke the social license of the fossil fuel industry, because they are not going down without a fight. And as long as they are at the table, dictating the rules, influencing public policy, we're going to have a very difficult time accomplishing what we have all set out together to accomplish. So with that, I thank you for your thoughts, and it's my pleasure to introduce our next speaker, Dr. Garfield Clunie, who is currently the president of the National Medical Association. Dr. Clunie.
Good afternoon, everyone. Hope you can hear me okay. Right, this over here. And thank you for inviting me to give remarks on behalf of the National Medical Association. As you may know, the NMA was founded in 1895 during an era in the US history when African-American physicians and patients were disenfranchised. Black physicians were barred from training and working at certain hospitals, and Black patients were similarly restricted from receiving care at certain institutions, even receiving care from white nurses. Although the segregated policy of separate but equal really did not, although the segregated policy of separate but equal was dictated by virtually every aspect of society, separate but equal really didn't exist. Racial exclusive Jim Crow laws dominated employment, housing, transportation, recreation, education, medicine, and Black Americans were subjected to all the injustices inherent of a dual medical system. Sounds very much like what we're dealing with now with the social determinants of health. Under the backdrop of racial exclusivity, membership in America's professional organizations, including the American Medical Association, was restricted to whites only. The AMA determined medical policy for the country and played an influential role in the broadening and expertise of physician training. But when Black doctors sought membership in the AMA, they were repeatedly denied admission. And thus, NMA was created by Black doctors for Black doctors and health professionals as they found it necessary to establish their own medical societies and hospitals. Similarly to what Dr. Mitchell has done in terms of the Chef Fellows, there's a parallel there. A problem occurs and we find a solution for that problem. Today, the National Medical Association is the largest and oldest national organization representing about 50,000 Black physicians and the millions of patients, multiracial patients we serve. And I'm the 123rd president of this great organization. Our mission is to achieve the art and science of medicine for people of African descent through education, advocacy, and health policy to promote health and wellness, eliminate health disparities, and sustain physician viability. We're committed to improving the quality of health among minoritized and disadvantaged people through professional development, community health education, advocacy, research, partnerships with federal and private agencies. And although historically the NMA has focused primarily on issues related to African Americans and medically underserved populations, its principles, goals, initiatives, and philosophy encompass all ethnic groups. Therefore, the National Medical Association is the collective voice of African American physicians and the leading force for parity and justice in medicine and the elimination of healthcare disparities. The NMA is very proud to co-sponsor with the George Mason University Medical Society Consortium on Climate Health, the Climate and Health Equity Fellowship Chef Program, to train the next generation of physicians of color to help diversify the climate health movement. As stated in a USA article earlier this month, which was quite timely, climate change affects people of color the most, but TV news lacks representation. We know that communities of color are disproportionately affected by environmental pollutants and the effects of climate change, and no one is going to look out for your best listeners, so to speak, other than sometimes your own. Therefore, it is essential that we have people of color educated and advocating for better environments for people of color. Redlining in the 1930s led to African Americans living in areas that had more pollution and were less environmentally safe. The fellows that come from this program will continue to call out this wrong and work towards education and solutions for this crisis. They will serve as the trusted messengers to communities of color on this issue and solving problems similarly to the way NMA serves as a trusted messenger in healthcare to Black patients, advocating and working towards reducing disparities and increasing equity. As the article goes further to say, climate change coverage has fluctuated over the past decade, and although there is a slight uptick in coverage on this important issue, there is still a lack of people of color who are making guest appearances to talk about this issue. And this fellowship will improve that statistics. Including voices of advocates and experts of color in television coverage is critical, as television and other social media networks are influential sources in informing Americans on the climate crisis, not unsimilar to what happened with COVID-19. We therefore salute all the members of the third-year class of this fellowship as they embark on this intensive learning experience. But we also salute my friend, Dr. Mark Mitchell, on conceiving this program and bringing it to fruition. As an organization, the NMA also honors its outstanding members and professionals who have made major contributions in medicine towards the work of the NMA itself. I bring this up because if you didn't know, I'm going to embarrass you again. In 2019, Dr. Mitchell was honored with the James M. Whittico Jr. MD Health Advocate Award. Dr. Whittico was a past president of the National Medical Association and a surgeon, and the first African-American to become a full professor at any medical school in St. Louis, Missouri. Dr. Whittico believed that the permanent progress of the race must rest on education and the development of industrial interests. Every year at our annual colloquium on African-American health, which is coming up this coming weekend, the NMA recognizes a member who has made significant contributions in the area of public health with this award. Climate change and its implications on health is and has been a high priority of the NMA. And we are very proud that our Dr. Mark Mitchell and others are leading the way within NMA in addressing effects of climate change on our environment. Dr. Mitchell has been an outstanding and vocal advocate for the effects of climate change, and therefore there was no better person to receive that award than. And some of you may know this person who's in the audience, Dr. Cheryl Holder, who has done a lot of work in climate change as well, and she knows this, will be receiving this award this year. Also, through Dr. Mitchell's efforts, an official council of the House of Delegates of the National Medical Association was also created to address climate change and the effects on the African-American community. And this council is called the Council on Environmental Health. Also, with his assistance, we're planning a plenary for our national meeting on climate and health as well. And we will be inviting our EPA Administrator, Michael S. Regan, to be the keynote for that plenary. I hope you all can attend. It's going to be in New Orleans, our national meeting in July. Along with climate change, some of the other priorities for the National Medical Association that I'm working on this year include, as a maternal field of medicine doctor, the crisis that we see in maternal mortality. And I'm not going to go too deep into it, but as we know, Black women are dying at 3 to 4 times higher than white women for reasons we don't know. We think implicit bias, explicit bias may play a role in it, but we really need to delve into this subject. And not only is it 3 to 4 times across the country, in some zip codes in New York City, for instance, it's 8 times. And in a country as rich as ours, that's really unacceptable. In Congress, Dr. Robin Kelly is putting forth a bill called the Mamas Act, the Mothers and Offspring's Mortality and Morbidity Awareness Act. And the reason why I bring it up is because NMA is going to be going to Capitol Hill next week supporting this bill because it does a couple of things. It acts to try to reduce the implicit and explicit bias in medical care by mandating standard protocols for care, but also although the staggering number of 3 to 4 times or even 8 times is bad, 80% of maternal mortality is preventable. And that's 4 out of 5 women. And so we really need to do something about this. And so we will be advocating for that as we go forward. The other issue that we are working very hard on this year is increase in workforce diversity. in similar parallels to climate change and having a diverse voice speaking about climate change. There's a lot of data that shows that race concordant care does reduce disparities and increases equity and increases access. And so from a medical standpoint, when we look at the numbers, although we're 13% of the population, we're only about 5% of the physicians. And this number has been flat for a long time. And so we will be working with partners like the AAMC, the Association of American Medical Colleges, on programming to increase and assure that the pipeline of Black students who want to go into medicine is supported. Somewhere along the line, some folks get derailed, and we want to try to, prevent that from happening. Also, there's another bill that will be supported next year coming from Congresswoman Lee that talks about, it's the National Medical Corps Act. And what she's doing is some of us start out in community colleges because we don't have the resources to sometimes attend big colleges and universities. And what her bill is doing is going back and supporting those students that show real potential in community colleges and ushering them along the pathway as well. I think that it's really important to increase the diversity of our workforce, and not to say that a Black patient needs a Black doctor to do well, but I think patients like to see, just like we all like to see, a diverse environment when we go anywhere, and we feel more comfortable about accepting the care and the advice that we would get from those areas. So those are a couple of things I'm working on this year, but I'm just going to close by saying I really appreciate the opportunity to address the group. And I think it's really phenomenal, this climate change work that has been done. The first year was 3 fellows, then it went to, I think, 12 and then 13. Some of the fellows presented this morning from last year's group, and they're really doing some phenomenal work to even the playing field with climate change. And so thank you again. And I look forward to hearing what the next set of fellows are going to produce for the upcoming year. So thank you.
Thank you so much, Dr. Clunie. And the Climate Health and Equity Fellowship is really one of the jewels in the crown for the consortium in terms of the work that we undertake. So we're grateful for the opportunity to highlight it.